The Affordable Care Act has completed its first year of open enrollment, and despite some significant technical challenges, 8 million Americans have used the state or federal health insurance marketplaces created by the ACA to access insurance. Of the 8 million Americans who have used the exchanges to access health insurance, over 216,000 of them are Virginians. In addition to the 8 million, 3 million more people have been enrolled in Medicaid or CHIP as of February, compared in addition to the marketplaces opened, and those Medicaid and CHIP expansions were because of the Affordable Care Act provisions. In addition, an estimation of 3.1 million young adults have gained coverage by being able to stay on family policies till age 26. The combined numbers just in this expansion of coverage is now more than 14 million Americans. I'm proud to co-sponsor today a bill that is the lead sponsor, is Senator Franken, called the Family Coverage Act, introduced today. The ACA requires large employers to offer affordable health care coverage to the employees, and the IRS definition of affordability suggests that that means an employer's share of the premiums of individual coverage rather than family coverage is less than 9.5% of family income. If the employee has an offer of affordable insurance, the employee and the family cannot receive premium tax credits. If it's not affordable, you can receive tax credits. This measure of affordability based on what the premium is for the individual versus what the family premium is leaves a lot of spouses and families cut out from the possibility of receiving tax credits under the ACA. An average plan for an individual costs about $5,600, but according to the Kaiser Family Foundation, that average goes up to about $15,700 for families. And so GAO estimates that the currently used definition of affordability would prevent nearly 460,000 uninsured kids from accepting tax credits, even though their parents qualify for that affordability for the tax credit under the ACA. This is known as the family glitch. It was sort of an unforeseen consequence when the bill was written. So the Family Coverage Act that Senator Franken is championing with many other co-sponsors would change the definition of affordability within the ACA so that family members of the parent who works for a company that offers health insurance can qualify for tax credits as well. Mr. President, I've co-sponsored other fixes and improvements to the ACA, a small business tax credit enhancement, expanded consumer choice through a plan called the Copper Plan, which provides all the coverages but at a lower premium because those choosing the plan will pay more on the deductibles. They can buy down their premium by more cost sharing. A reporting act introduced by Senator Warner to ease compliance burden on employers. An act to protect volunteer firefighters and emergency responders. Many of us were co-sponsors of that bill. An act called the EACH Act, which is a technical correction to the religious exemption in the ACA. And I've also written a lot of letters to the administration asking them to do things within their administrative purview to make the act better. And Mr. President, this is what we should be doing. We shouldn't be talking about repealing the Affordable Care Act and taking 14 million people who have insurance through the ACA and telling them back out into the street with you. We shouldn't be talking about stonewalling a wonderful public servant from coming in and being head of the HHS. We should be engaged in the business of reforms and improvements. This is what legislators do. Certainly, we've learned through the bad rollout and some other things that nobody can stand back and say this thing is perfect and no reforms are needed. Reforms are always needed. But I would also hope my colleagues might have learned something, those who wanted to repeal the Affordable Care Act, those who were willing to shut down the government of the United States to advocate a repeal of the Affordable Care Act. They should also be focused now on reforms, not repeals, because repeals mean those 14 million would lose insurance, and families like mine would now be subject again to being turned down because of pre-existing health conditions.